the first words come to their mind is not comfortable.
Yes.
Because we have like a more flattened chest, like compared to the other ethnics. And we take our courage with two hands. That's what says my daughter. She says, Mom, I'm going to take my courage with two hands.
2024年11月，我受邀来到加拿大癌症中心采访，推广魁北克省乳腺癌筛查计划。魁省所有50至74岁的女性都可以接受每2年1次的免费乳腺钼靶筛查。这一天，我有幸和罹患乳腺癌、如今已痊愈的 Mona 医生以及华人社区推广大使开梅老师进行了一场走心的访谈。
Because a lot of Chinese patients, like Chinese women, when they hear the word mammogram, first of all, the first words come to their mind is not comfortable.
Yes.
Because we have like a more flattened chest, like compared to the other ethnics. Yeah, and it actually hurts a lot, or they will be anxious about going to take the mammogram.
I understand.
Yeah. How would you suggest us?
Yes.
Yeah, go through these anxieties.
So I guess that as human beings, we all have the same emotions. So fear gives a lot of discomfort, but it's absolutely normal to have fear when you have that letter, because of course our mind is going to anticipate the worst case scenarios. Oh my God, if I have breast cancer, if I don't have, what should I do? And so the most common and primitive way that the mind tries to protect us from the fear is to say, deny. Oh, no. Let's
Nobody know about it.
Exactly. I put it in the garbage. This is normal. I mean, no shame, no blame. Every human being prefers to toss the letter in the garbage. But we are not primitive. We want to progress. We want to be healthy. We want to live well and long. So we don't toss that letter. And we take our courage with two hands. That's what says my daughter. She says, Mom, I'm going to take my courage with two hands. And I'm going to do this and that. Yes, you do that. You take your courage with two hands. And if you don't have enough courage, you ask a good friend, your mother, your daughter, your sister, anyone from your community who can help you get that appointment and do the mammogram.
Yeah.
So yeah, this is a responsibility you need to take, but it's absolutely normal to have fear.
You're setting a very good example for your daughter, give her a lot of courage, as well as you set a very good example for our women in our Chinese community to be brave and to encourage yourself to do something very important. Good for your health.
It's just, I just think about one factor is fear.
Yes.
They put the letter like garbage.
Yes.
Another factor is when they see the French, they was a little frightened also.
Oh yeah.
Yeah.
Of
So
course.
I really appreciate you use English to talk to us. They are very hard workers for studying French right now, but now you get to that level, able to read well and understand the message, many of them, when they just arrive.
I understand. Well, being an immigrant is always a vulnerable position in all societies. And I can tell you a lot about that because I grew up in France where my parents were immigrants. So I lived when I was a young girl with a lot of fear and feeling that my parents were in a vulnerable position. They didn't have the citizenship for so many years and they were living with this scar that they had to renew. And that was a lot of stress. And as a child, I could feel it. And also I unfortunately tasted a lot of flavors of systemic racism that is present everywhere in all the societies. So I really feel deeply in my heart what it may mean for your community, like all these fears, like understand the language and yes, it's a lot of challenges. It's a lot of obstacles.
Yes.
But hopefully, people like you are here. So I can see that you are a very resourceful person and that you want to raise awareness and knowledge in your community and empower your community. And also the Cancer Canadian Society provides a lot of counseling and help. So even if you are not speaking even French or English, maybe get the help of someone who can speak English and French, and then at the society they can find a person who can speak your language. So, I think that we still are lucky to be in Quebec, where, all the societies are imperfect. Human beings are imperfect. So there are obstacles, there are issues, there are a lot of things. But still in Quebec and in Canada, all the people in your community can get this mammogram beginning at 50 years old. So, I'm sure that what you are doing today and what you are doing every day will help raise that awareness, that knowledge, and that courage.
Yes, surely I think when they hear about our discussion, I think many people will be encouraged to take that decision to go to their first mammogram.